Welcome, and let's learn. What are you guys doing in Sacramento County Office of Ed?
Yeah, thanks so much, David. Really appreciate it. So good to see all of you today. It feels great to be celebrating this Friday with so many amazing folks. As a reminder, I'm part of the capacity grant team now, but I was a part of SCOE's school-based mental health and wellness program for the past 5 years. And I was there day one when we launched, when there was, I think, 12 of us in a room with a lot more questions than answers, and trying to figure out how do we partner with an FQHC? How do we figure out this thing that, at least the way we were doing it, in the particular way we were doing it, I think had never really been done before. And so that first year was a lot of figuring things out. And at the time, I was just a clinician, so I was a little bit more on the ground. But to prep for this little amuse-bouche for our COP next week, I did talk to Brent, who was a big part of launching this, to kind of get a clearer sense for how did we begin this? Because I would imagine if any of you are interested in FQHC, you might be thinking, okay, how do I even begin this process? So that's really kind of the focus of this presentation. And my wonderful, amazing, insightful colleague, Latoya Ramsey, is currently a coordinator in that program, and she'll be presenting at the very end for a couple slides to kind of give a little bit more concrete on the program. But I wanted to kind of start us off with a little bit of explanation of how we started and the way we work. Okay. Isn't cool. Can folks see? Oh, it's still loading. Can folks see those slides? Cool. All right. Yeah, so let me start us off with what is an FQHC? If you're coming into this conversation cold and you're just like, okay, you've already used an acronym and I am already lost, hopefully this slide is helpful to you. It's a federally qualified health center. There are various different kinds of FQHCs out there. Planned Parenthood is actually an FQHC that's like more commonly known out there. But there's a variety of ones that are out there in every county. They're federally run, federally funded, um, and they're really designed to support medically underserved communities, to provide comprehensive primary and preventative care, regardless of a patient's ability to pay. And in 2024, they provided mental health services to about 3 million patients in the United States and screened more than 74% of teens and adult patients for depression that they served. So how did our program begin? So I want to give major props to Superintendent Gordon here at Sacramento County Office of Education. His dream fully was this kind of work of how do we do school-based mental health services at a school site. I probably don't need to like pitch it too hard because all of you are here for a reason. But I will say, as someone who was a part of that program from the beginning, over and over again, Superintendent Gordon came to meetings. He would come to our orientations to meet all the new staff. When things would come up, he was very engaged, very supportive. So I really want to like give him major props because I think in a lot of ways this dream started with him. And then, of course, Brent as well, who all of you might know. Um, and so talking to Brent about like how this kind of was initially started, he talked a lot about how it really starts with strong relationships at the top. So there are a lot of meetings he did with the county health director and of course Dave Gordon and building a common goal around school-based mental health services. They tell a story too about like hopping in a minivan and driving down to Fresno to actually see what Fresno was doing. It's a different model. It's not really the FQHC model, but they hopped in a minivan just to see like, wait a second, I want to see how school-based services are being done somewhere else. And like, let's just drive and go there and see it. I know that was helpful to them too. And like he says here on the slide, Brent was saying they didn't go in thinking they would use the FQHC model. They just wanted sustainable services. And so that was the route that made sense here in Sacramento, but maybe that route doesn't make sense for you. And then they also talked a lot about like really hearing feedback from CBOs. A lot of the behavioral health CBOs, interestingly, were a little bit worried about like the referral flow that they were getting being interrupted when we started our program, and that has not been shown to be the case. I remember in the first year we did some like community or practices with some CBOs to sort of support with linkage and supporting with that kind of worry. And honestly, yeah, I think there's more than enough need here in Sacramento County, and that worry I think was allayed luckily. And there are a lot of advocacy groups and behavioral health directors at the districts that were really bought into this from the beginning as well. Cool. So we've got a little slide here to kind of just show, all the different partners that have really helped make this happen. Districts, County Department of Health Services, the various medical plans we have here in Sacramento County. Yeah, SCOE, and then student, family, and community partnerships. So to get a little concrete, because some of you again might be wondering, like, okay, that sounds great, but like, what does this actually look like? What are the benefits of this? What's the pros? Why did you go this route? So the way we do it here in Sacramento, that again I think is pretty unique, is we actually extend the health center to the school sites we're at. So I guess we have a full-time clinician at a school site, and we've reached out to HRSA that oversees the FQHCs, and we've gotten approval for the school site to essentially be a satellite center of the FQHC. And so we have to follow a lot of the FQHC's policies. The one that we're partnered with here is the Sacramento County Health Center. So we have to follow the Sacramento County Health Center's policies on that school site. But the benefit is we get to use the EHR, which is great. And then also the health center has a billing person that does all of the back-end billing for us. The health center does receive some reimbursement from the services that we bill for, and we receive a percentage as well too. And then, of course, one of the biggest benefits is we get enhanced Medi-Cal billing through the FQHC. So we get billed at a bit of a higher rate than if we had gone through county behavioral health to contract for this. And so we have some like braided funding that we've used to support our program over the 5 years. Some of these have sunsetted, but yeah, SB HIP, which I imagine a lot of you might have used, MHSSA, and the SCOE General Fund. And then currently we're still billing, at the sites that we're at. And then we're still using SMA as well. And then now we're kind of just slowly starting to roll out the multi-payer fee schedule as well for our school sites. Cool. So yeah, so just again, kind of breaking down a little bit of what I've already said. The clinicians are hired by SCOE as employees at SCOE, but we're under the FQHC model. We provide direct clinical mental health services to the student. We're doing largely tier 3 services because that's really what's billable within the FQHC model. But luckily, because we get the higher reimbursement rate, like when I was at my school site, I was doing a lot of tier 1, tier 2 stuff. I ran a Dungeons and Dragons therapy group, which I loved. It was so much fun. And then like I would also push into the class and do SEL lessons for some of the classrooms as well. And those things weren't really billable, but again, because we're able to bill at the higher rate, I had time and space to do those things. And then we're really starting to focus too in the past year or two to really focus on making sure we're serving that 0 to 5. So I know we've partnered with a couple school sites that have kind of Head Start or preschools on campus to really recognizing, right? A lot of the research shows that like the earlier interventions you have with around mental health, the more impact you have. And often it doesn't take a lot actually. So it's both effective, but it's also effective as well too. And so we have MOUs in place between SCOE and each school site, as well as with HRSA, in order to leverage this funding. Cool. And then I will pass it over to LaToya.
Thank you, Patrick. Yes, and thank you for the introduction, Patrick. And Patrick was part of the first cohort of clinicians that came in to our school-based mental health and wellness program. And I was part of the second cohort of clinicians that came in. So before stepping into the coordinator role, I was a clinician for 4 years in one of our Sac City Unified School Districts, providing mental health services to students, direct service one-on-one. So replicating schools of centers of wellness. We begin by building strong relationships with school leadership, staff, and families to understand each school site's unique needs. Our clinicians are embedded into the school community, which allows for consistent and responsive support. We use a trauma-informed lens and implement services through an MTSS model, ensuring that students receive the appropriate level of care, whether it's tier 1, targeted group supports, or individualized interventions. Our clinicians are placed at one school site for consistency and continuity of care. Our associate clinicians receive supervision from their SCOE clinician 2, are also known as their clinical supervisor, to gain their clinical hours. Next slide, please. Yes, and so we also have workbooks to ensure clarity and consistency and effectiveness across our team. The school-based mental health and wellness program has developed comprehensive workbooks tailored to each role within our program. So this includes our clinicians, our associate clinicians, family navigators, clinician twos, and our coordinators. So each workbook step serves as a step-by-step guide outlining key tasks, goals, timelines, specific to each position. The workbooks are organized into phases and timelines. So this helps staff stay aligned with program objectives and tracks progress. So by providing structured support, the workbooks enhance our ability to deliver mental health services in a school setting. And so we also found that there can be some role confusion. So there can be role confusion on school sites between the clinicians, social worker, maybe outside therapists that come to provide services on the campus. So the workbooks have really reinforced our role as clinicians hired by SCOE to provide mental health services and Tier 3 support to students. So each clinician's goal is to provide 20 billable sessions per week for our program sustainability. Next slide, please. So in the past, we have school-based mental health and wellness. We have hosted a Schools of Center of Wellness or SCOW convening, which is an event that brings our partners together to explore and engage in our model of delivering school-based mental health services through Medi-Cal billing. This previous school year, from our in-person convening, we created a free asynchronous virtual convening, and this virtual convening includes insights from clinical creativity, staff-led presentations, and a comprehensive overview of our program. So it serves as a platform for collaboration and information sharing to expand mental health access in educational settings. So the virtual convening, which really gives an overview of our program, will be linked, and you'll all be able to take a look at it. Thank you.
Hey, thanks so much, Latoya. Really appreciate that. And if you do look at the clinical creativity, you will see yours truly presenting at that as well. Cool, beautiful. Great to see the comments in the chat about people being excited about this. Yeah, definitely check out the training resource, the virtual convening, the workbooks, the role workbooks that Latoya talked about are also on there and free to look through. I've definitely found those really helpful. Um, just real briefly, to kind of wrap up, I was emailing with Matt at El Dorado County. I know that you are kind of starting to do the FQHC piece, and any pieces you want to add about like stuff that you have found that has been helpful to begin this work, Matt?
Yeah, just the emphasis of the early stages of having the discussion. The FQHC has been willing to do that traditional format of, yes, we have a clinician that can work at your site for 1 day a week type of thing, and see 6 or 7 kids, but you don't ever get the connection to the school and the campus and the development and the build up that happens if it's a fully implemented program. So we've done a little bit of piloting. We definitely, if we go that route, we want to go bigger and make sure that we can do similar to what SCOE's done and really have a clinician that is placed there full term type of thing so that they can really buy into the concept. Same thing with the wellness coaches, be able to place them full term and be able to have them buy in. So it is a different language though. And so I would highly recommend you almost have to take a course on FQHC to be able to understand the language and understand the terms and the rates. And there are incentives, but there are risks also. And so yeah, there should be a course like 101, which it kind of sounds like you guys are doing, which is great because that will really help in being able to have that conversation. I know there's a lot of nervousness about anything that's connected to federal programs. So, that to me is where the risk piece comes in, but there's definitely incentives and possibilities that come out of it. And we're literally just having, we've done a little piloting and then starting to have some conversations. We're at that stage of, not knowing what we don't know. But we're learning quickly.
Mm-hmm. Yeah, thank you so much, Matt, for uplifting those pieces. I really appreciate that. And we found that a lot in year one, that there was a lot of like assumptions that and confusion between like bridging the gap between the FQHC, the health center, and the school-based services. And I mean, still really 5 years in, there's still pieces occasionally where it's like, wait a second, there's this policy you have that doesn't make a lot of sense on the school site setting. So yeah, agreed. There's a lot of work to be done in that area. All right. Well, thanks so much, everyone. And I will pass it back to David.
Wonderful. Thank